Welcome, dear students, to today's session. Today, we will learn about temporomandibular joint. Let us discuss the topic under the following headings. Number 1, introduction. Number 2, participating bones in the formation of the joint. Number 3, ligaments and their brief account. Number 4, arterial and nerve supply of the joint. Number 5, movement of the temporomandibular joint. And last but not the least, number 6, applied in relation to the joint. The mandible articulates with the base of the skull by a pair of synovial joints called temporomandibular joints. The joints of both sides move as one unit and form a bicondylar articulation. The type of temporomandibular joint is an example of synovial joint. Its subtype being condyloid structurally and modified hinge functionally. Now, let us talk about the bones coming into formation of temporomandibular joint. This joint is formed by articulation of two bones. Above lies the articular tubercle and anterior articular part of the mandibular fossa of temporal bone. Below lies the head or condyloid process of mandible. So, temporomandibular joint occurs by articulation of two bones, above and below, temporal and mandible. The articular surfaces are covered with fibrocartilage. An articular disc intervenes between the mandibular fossa above and the head of the mandible below. This articular disc divides the joint into an upper and a lower cavity. Upper cavity lies between the temporal bone and the articular disc, which is called temporomeniscal joint, and the lower cavity lies between the articular disc and the head of the mandible, and this portion is called meniscomandibular joint. The cavity of each of the joints is lined by a separate synovial membrane. Similar articular discs are present in sternoclavicular joint, shoulder joint, inferior radioulnar joint, hip and knee joints. Now, let us learn about the ligaments of temporomandibular joints. The joint presents the ligaments, namely, number 1 is capsular ligament with synovial membrane. Number 2 is articular disc. Number 3 is the lateral ligament or temporomandibular ligament. And number 4, accessory ligaments, which includes sphenomandibular ligament from the spine of the sphenoid to the mandible, and stylomandibular ligament from the styloid process of the temporal bone to the mandible. Now, let us learn about the capsular ligament. The capsular ligament envelops or surrounds the joint. It is attached above to the articular tubercle in front, squamotympanic fissure behind, and margins of the mandibular fossa in between them. Below, capsular ligament is attached to the neck of the mandible. In front, it blends with the insertion of the muscle, lateral pterygoid. The synovial membrane lines the inner aspect of the capsule of each compartment of the joint, but fails to cover the articular cartilages and the articular disc. Number 2 ligament we will learn about is the articular disc. This one is the articular disc which intervenes between the two parts of the joint. Above, temporomeniscal, below, meniscomandibular. In between them lies this articular disc. It is an oval plate of fibrocartilage which caps the head of the mandible and divides the joint into two cavities. The disc is attached at the periphery to the inner aspect of the fibrous capsule and in front it blends with the lateral pterygoid muscle. Posteriorly, the disc splits into an upper and a lower lamella. In between these two lamellae lies the venous plexus. Upper lamella is attached to the posterior margin of the mandibular fossa. Lower lamella is attached to the back of the head of the mandible. Structurally, the articular disc consists of 5 parts from before backwards, namely anterior extension, anterior thick band, intermediate zone, posterior thick band, and the bilamellar region. So, from anterior to posterior articular disc consists of these 5 parts. Nutrition of articular disc is received from the synovial fluid, its periphery from the capsular arteries. Articular disc functions as a shock absorber. It also increases adaptability of the two articulating bones. Now, we will talk about the lateral ligament or temporomandibular ligament. Lateral ligament or temporomandibular ligament is the condensation of the capsular ligament. It blends with lateral part of the fibrous capsule. It is directed downwards and laterally on the lateral side of the joint. It is attached above at the tubercle of the root of the zygoma, below at the lateral and posterior surface of the neck of the mandible. Now, we will talk about the sphenomandibular ligament. You see, on a coronal sectional profile, this is the sphenomandibular ligament. It lies on the medial side of the joint. It represents the remains of the first pharyngeal arch in this region. It is attached above to the spine of the sphenoid, below to the lingula of the mandibular foramen. This is the mandibular foramen. Here lies the lingula of the foramen. So, it extends from the spine of the sphenoid to the lingula of the mandibular foramen. Laterally, this ligament, sphenomandibular ligament, is separated from the neck of the mandible by lateral pterygoid muscle, auriculotemporal nerve, maxillary vessels, inferior alveolar vessels and nerve, and a part of parotid gland. Medially, it is related to cauda tympani. Pharynx separated by fat and pharyngeal venous plexus and medial pterygoid muscle. This ligament is pierced by mylohyoid vessels and nerve. Stylomandibular ligament. This one is the stylomandibular ligament. It lies behind and medial to the joint and some distance from it. It is formed by thickening of the deep cervical fossa and extends from the tip of the styloid process of the temporal bone above to the angle of the mandible below. It separates the parotid gland from the submandibular gland. Now, about the arterial supply of temporomandibular joint. Temporomandibular joint receives its arterial supply from the superficial temporal branch of the external carotid artery and masseteric branch of the maxillary artery. Nerve supply is from auriculotemporal nerve, which is a branch of posterior division of mandibular nerve, and masseteric branch of anterior division of the mandibular nerve. Now we will learn about the movement of the temporomandibular joint. Movement permitted at the temporomandibular joint are protrusion and retraction, which take place in the upper temporomeniscal joint. Next movement is elevation and depression, which take place in the lower joint or meniscomandibular joint. Another movement is side to side or chewing movement, which take place in both the joints. So the movements permitted at the temporomandibular joints are protrusion and retraction, elevation and depression, and side to side or chewing movement. Let us consider the movement of the temporomandibular joint during mastication. During opening of the mouth, first there occurs protrusion of the mandible, which is done by lateral pterygoids. It is followed by depression of the mandible, which is done by the following muscles of both sides acting together. What are those muscles? Lower fibers of lateral pterygoid, digastric, mylohyoid, geniohyoid. Last three muscles, namely digastrics, mylohyoid and geniohyoid, are acting from the hyoid bone, which is kept fixed by the infrahyoid muscles, namely sternohyoid, thyrohyoid and omohyoid. During closing of the mouth, at first there is elevation of the mandible done by the following muscles of both sides acting together. What are they? They are medial pterygoid, they are masseter, are anterior fibers of temporalis. It is followed by retraction of the mandible done by the posterior fibers of temporalis of both sides acting together. Side to side or chewing movement. Head of the mandible of one side moves forward, backwards and rotates alternately with that of the opposite side during this chewing movement. When one side moves forward and rotates, other side move backwards and rotate. It is done by the lateral and medial pterygoids. Of one side working alternately with those of the opposite side. Now, the applied anatomy in relation to the joint. First, same nerve supply. The temporomandibular joint, external auditory meatus, teeth of the lower jaw. So pain from one may be referred to the other. Number 2 applied. If the capsular ligament of the temporomandibular joint is lax, then while opening the mouth during eating, yawning, the head of the mandible may cross the articular pillar and goes out of the articular fossa. In such case, the head of the mandible is drawn up by the temporalis and the mouth cannot be closed. This is what is called locked jaw. That's all. Thank you very much.